Recognizing the member for Peace River North.
Thank you very much, Madam Chair. Thank you very much to the Ministry and the staff for being able to allow us questioning. To the Minister, if the government is serious about fiscal responsibility in a time of deficits and federal cuts to health transfers, it should start cutting costs at the top. Excessive executives and vice presidents before touching essential frontline services and seniors care. Our seniors paid into the system their entire working lives. They deserve dignity in their later years, not to be shafted by poor budgeting and delayed projects while the system fails to plan for an aging population. That's not even mentioning the average British Columbian who can't find a family doctor or patients dying on specialized wait lists, which has been shown by FOIs in my region. People shouldn't be occupying acute care hospital beds because there are no long-term care spots or waiting at home or worse. At places like the Salvation Army, cutting the administrative bloat and redirect those dollars to Peace Villa expansion, more long-term care beds and frontline staff. Northern Health has seen its system worsen under current leadership despite high executive compensation. Budget 2026 needs to demonstrate real value for taxpayers, not just high totals on paper. Why did the President and CEO of Northern Health receive a raise of $100,000, bringing total compensation over $450,000 in recent disclosure, while key performance metrics in Northern Health access, wait times, and outcomes have not improved and in many cases have deteriorated?
Recognizing the Minister of Health.
Thank you very much, Honourable Chair. Welcome to the member. Good to see you here, part of estimates. I just want to start off with I think the approach the member is taking in his question here is around value for money in our healthcare system and ensuring that every dollar we spent is being maximized for patient care, and that we're seeing the outcomes that we want to see and that we expect to see, and that frankly British Columbians deserve. And I share the members' concern that we should do everything possible to do that. And at the same time, we need the dedicated professionals. We need to attract them to work here in British Columbia to be part of our healthcare system, who are aware of the resources that we put into our system and ensuring that we get every bit of value out of that. The member cited some salary increase figures that I just want to point out that the CEO of Northern Health started partway into the fiscal 23-24. So as a straight comparison of remuneration from 24-25 over 23-24 is going to artificially inflate what might look like a rise when indeed it was a full year being compared to a partial year. At the same time, as the member knows, we have undertaken a big exercise in government looking at cost management, and further to that, looking to the health authorities and undertaking an intensive and comprehensive administrative review to make sure that we are avoiding as much duplication, redundancies, and wasted dollars, to redirect them to the front line, because we know that's where they are particularly needed. And by doing that, we can ensure that we are building out the physicians and nurses and all the healthcare workers that we need, that we're putting the investments into the facilities, the surgical suites, the clinics that British Columbians need to access care, and that we're keeping pace with technological improvements, equipment upgrades, increasing the number of diagnostic machines, for example, so that British Columbians can have access to those. I think it's worth pointing out that there is a metric called the Corporate Services Expense Ratio that is measured by the Canadian Institute for Health Information, and they look at all provinces and territories across the country. And British Columbia is the second lowest of all jurisdictions in Canada, with a corporate service expense ratio of 3.5% in fiscal 22-23, compared to the Canadian average of 4.4%. That doesn't mean that we don't have a responsibility to continue to look and to find those administrative savings, and that's what we've done. Over the past year, there are 1,100 senior positions that have been left vacant or unfilled, for an annual cost savings estimated at $60 million. Further to that, before even the results of the Health Authority review began to come in, the health authorities undertook cost management exercises and found another $200 million in annual savings. With the Health Authority review making a recommendation to take certain services like IMIT, legal, HR, and other services and centralize them into shared services organization, that's exactly what's happened. And on April 1st, the BC Health Shared Services Organization was stood up to do just that. And over the coming months, units will be moving out of regional health authorities into a centralized system. And the estimated savings are in the order of hundreds of millions of dollars, although I don't have a precise estimate to provide the member with today. So we're going to continue to do that work, identifying where those bottlenecks are, where those redundancies are, where there is inefficient funding that could be better used to optimize service delivery. And we'll be able to talk more explicitly about this work in the coming months, but this certainly has been part of the mandate letter that the Premier gave me and the job that I have before me together with the rest of government. I do want to just take a moment, though, to talk about Northern Health Authority, where the member lives and where his constituents live. And we know that people who are living in smaller and more remote and rural communities face bigger barriers to accessing care than people living in other parts of the province. And that's why the member will know so many dollars have gone into new facilities like Dawson Creek Hospital, like Fort St. James, the Natsuje Hospital, like Terrace, because people living in rural and remote communities deserve the same standard of equipment and services that people living in the Lower Mainland do. And so that's why the funding allocation to Northern Health continues to reflect the particular needs of that population, and why we will continue, as I've canvassed with a few different members during estimates, the population needs-based funding model that takes into account things like rurality, things like social determinants of health that place Northern residents at a more vulnerable place in being able to access healthcare, partly because of the distance, partly because of the social conditions under which they live, their access to housing, food, other things that determine how healthy a person can be and what their health span and lifespan will be. So I think we have a lot to be proud of in British Columbia's health system, our public universal healthcare system. It provides excellent care to people, and that of course there's places where we need to continue to make improvements. And one of those areas, for example, of course, is in primary care, where we have been attaching more and more patients, where we are producing and recruiting more and more doctors and nurse practitioners to ensure that people get access to the care they need. Thank you, Chair.